Well, it is my absolute pleasure today to introduce an amazing person, Dr. Robert Ostfeld, who is a cardiologist. He's the director of preventive cardiology, the founder and director of the cardiac wellness program at the Montefiore Health System, associate professor at the clinical medicine at Albert Einstein College of Medicine. He earned his master's in epidemiology from Harvard, his MD from Yale. Do you have problems like when you go to Root? Who do you, oh, anyway. He's board certified internal medicine, cardiovascular disease, and echocardiography. He's co-authored many articles about cardiovascular disease and several about the relationships between periodontal disease and atherosclerosis. He has earned Outstanding Full-Time Attending of the Year Award at Montefiore for Excellence in Teaching Medical Residents, and the Program Director's Award for Dedicated Service on behalf of the Montefiore Einstein Cardiology Fellowship. He was elected to the Leo M. Davidoff Society at Einstein for outstanding achievement in teaching of the medical students. Patients who have enrolled in his program have experienced dramatic improvements in their health, making key and lifestyle changes under his amazing guidance. And many of these patients have been diagnosed with heart or blood vessel disease, and they've lost weight. That's a side effect, great one. But they've lowered their cholesterol, they've lowered blood pressure, they've increased energy levels, and even have reversed type 2 diabetes. So his program brings a very unique, nutrition-centered approach to the management of cardiovascular disease, aiming to prevent and reverse heart disease with a whole food, plant-based diet. I bring you Dr. Robert Ostfeld. Well done.
Jean, thank you so much for that incredibly generous introduction. And Joan and the Chappaqua Library, it's an absolute honor to be here with you all today. And I'm really grateful for you all making it out. I know it's really tough with the snow and everything. So thank you. And if people have questions along the way, raise your hand and we may be able to get them to them right away, or maybe table them after some slides a little bit later. And if you have trouble hearing me, just wave your hand. So thank you again. So Confessions of a Reformed Cardiologist, a plant-based diet, and your heart. So I've been interested in health and prevention for a long time. And when I was a kid, I had two brothers who died from an incurable disease. And ever since then, I've been interested in health and medicine, and one thing led to another, and I became a cardiologist. And I had the chance to train with some incredible people along the way, amazing scientists, amazing physicians. And I learned a lot, but I didn't learn much about a plant-based diet. And I learned a lot about medical therapies, which can be great, and procedures, and maybe a Mediterranean-style diet. But when I had finished all of my training, which was about 11 years med school, residency, fellowship, if you had told me about a plant-based diet, to be honest, at the time, I would have thought it was a little weird. And so after that, I came down to Montefiore to start to work and did all the things I was trained to do: medications, guideline-based procedures, a Mediterranean-style diet. And people got a little bit better, but they didn't get a heck of a lot better. There weren't these magical transformations, and I was, really getting disillusioned. And I'm like, what am I doing? Like, I didn't go into medicine so people would get a little bit better here, a little bit better there. I really wanted transformational change. And it was right around that time that I learned about the impact of a plant-based diet. And I was really taken by it, learned more about it, and have to give a lot of thanks to Dr. Caldwell Esselstyn, Colin Campbell for their incredible guidance and mentorship. And so we started our cardiac wellness program at Montefiore with the goal of preventing and reversing disease with a plant-based diet. And I say disease, not just heart disease, because yeah, it's good for your heart, but it's good for you for dozens and dozens of other reasons. And I've been a cardiologist now for about 14 years. And outside of a medical emergency, like somebody gets shot and has to be put back together again, I've never seen anything come close to the breadth and depth of benefits that a plant-based diet provides. I mean, we literally have patients crying tears of joy in our office because they feel so much better. Nobody cries tears of joy when I write them a prescription for a cholesterol-lowering medication. So I wanted to share a couple of patient stories with you to start. And there's one that we were fortunate enough to get published that was a very early on one that helped me realize that we were on a good path. And this was a woman in her early 60s, and she had had a heart attack. She was being taken care of at another hospital, and they did a cardiac catheterization where they take a special look at the blood vessels that feed the heart with blood. And she had a lot of blockages there. And they recommended bypass surgery, which is a very reasonable guideline-based recommendation, but she didn't want to do it. And that's cool, you know, the patient's the boss. So they put her on all the appropriate medications, and at the time she could literally only walk across the room because she would stop because of shortness of breath. And then somehow she found us, and she came down, and she was already on all the good medications, and she could just walk across the room. And so all we had left was to switch her to a plant-based diet. And we'll dive into more of the details of that in a little bit. So, okay, we did that. Fast forward 3 or 4 months. She's now walking for about 30 minutes on a treadmill, and then has to stop because she gets short of breath. She lost about 15 pounds, and her LDL bad cholesterol fell another 70 points on top of what it had already fallen on a statin. So she was doing great. But it got a little strange because then it became hard to reach her. I'd call and I just couldn't get in touch. And then like 3 months later, I get this call from yet another hospital that she had chest pain and she was about to have bypass surgery. I'm like, what's going on? Like I didn't understand. So what I later learned was that there was a major rift in her family. Half of the family thought the plant-based diet was great. And the other half of the family thought it was the opposite of great. And she was living with the half of the family who thought the plant-based diet was great and eating that way during the 3-4 months that she got better. But then she moved to live with the half of the family who thought the plant-based diet was the opposite of great. She went back to her prior eating habits, and over the course of another 3 months or so, decompensated and had bypass surgery. So for me, that was an incredible example of one, about the power of a plant-based diet and how quickly it can help people improve and how quickly things can reverse when you go back to prior eating habits. Now this one, I won't go into all this detail, but this is a guy who was having chest discomfort. And it started getting worse and worse. Sometimes he would have it even sitting still or after walking a few blocks. And he went to go see his regular doctor. And they did a stress test, you know, where we have someone walk and then run on a treadmill, and then we take a picture of the heart and we look at blood flow to the heart. And so his test was positive. And of course, only in medicine does the word positive actually mean something bad. But so he had evidence of poor blood flow to the heart muscle. And that's what was causing his symptoms in his chest. But he said, you know what, doc, I don't want to take any of those cholesterol-lowering pills, and I don't want anything stuck in me. So that means no cardiac catheterization, no procedures, and he didn't want to take actually any medications. Patient's the boss. And so he then found us, and this is what happened. This is where he was when we started. You can see he was a little overweight, just a little bit. His blood pressure was borderline. His LDL bad cholesterol was pretty high. And then he was walking 1 to 3 blocks, and he would stop because of chest discomfort. So we put him on a plant-based diet. That's all that we had to do. He wasn't interested in other things. And so by a plant-based diet, this is what I mean. Eating tons of vegetables, fruits, whole grains, beans, lentils, tofu, potatoes, yams, and avoiding anything with a face. If something has a face or comes from something with a face, don't eat it. Okay, so that's what we did, and we're going to circle back to this guy a little bit later and see how he did on a plant-based diet. Okay, so we're going to talk about a variety of things, and I tossed in some other slides toward the end that hopefully will be interesting. So we're going to talk a bit about the scope of the problem. And when I say problem, I mean cholesterol disease in the blood vessels that feed the heart and body with blood. So that's what I mean by the problem. We'll dive into some of the pathophysiology, why this problem happens, and then why might a plant-based diet be helpful. And then, of course, we'll go somewhere that's scary for a cardiologist, which is, of course, beyond the heart. So I need a little bit of audience participation. So what percentage of 12 to 14-year-olds in the US do you think have early signs of cholesterol disease in the blood vessels that feed their hearts with blood? All right, so I've got somewhere between, I think, 30 and 80. Nobody's going to do a Price is Right and do like 1%. Like, no. All right, I got a $1 out there. Okay, so somewhere between 30 and 80%. So great work. You guys are absolutely right. It is indeed somewhere between 30 and 80%. But you're much better than the medical students that I work with, because I usually get between 0 and 100% with them. But they're professional test takers, so you know. So it's about 2/3. 65% of 12 to 14-year-olds have early signs of cholesterol disease in the blood vessels that feed their hearts with blood. And we know this from pathology studies of kids who died for other reasons, and they examined their heart. And so as I look around the room, I'm pretty sure we are all older than 12. Maybe not emotionally, but at least numerically. So, and these are some pathology studies of people who have died. And so these are soldiers who died in the Korean War, the Vietnam War, and this is an analysis of about 110 consecutive trauma victims in around, I think it was about 1990 or so. And as you can see, the soldiers, these are young, healthy people in their early 20s, prime of life. From Korean War vets, almost 80% of them had significant blockages in the blood vessels that feed their heart with blood. The Vietnam War is a little bit lower, and there's some question if there was a different way of defining coronary disease in those populations. But you can see here consecutive trauma victims, about 26 years of age, about 78% of them had evidence of blockage in the blood vessels that feed their heart with blood. Much too high by any measure. Okay, so about 2 heart attacks happen every minute in the US. And a heart attack is, of course, when part of the heart muscle dies from a cholesterol blockage. And so, I don't know, we've been speaking now 9 minutes. 18 heart attacks have happened in the 9 minutes that we have been speaking. It is, of course, the #1 killer of adult men and adult women in the US. Women are about 6 to 7 times more likely to die from heart disease than they are from breast cancer. Now, clearly, you do not want either one, but it highlights the epidemiologic importance of heart disease. Oh, thank you very much. And this is, of course, a very costly endeavor, $300 billion or more a year in cost from cardiovascular disease. And most heart attacks happen in people with, quote, normal cholesterol levels. So in a country where it is normal to die from heart disease, I think our whole notion of normal is anything but normal. And so I was on service the other day, and that means seeing a lot of patients in the hospital, walking around for all throughout the hospital floors. And so I thought, I'm just going to take an informal measure. I'm going to count. I'm going to see how many patients I saw that day and how many of them have a disease like diabetes, high blood pressure, high cholesterol, or heart disease that could be reversed or prevented, I should say. It could be prevented with a plant-based diet. So, okay, it wasn't 9 patients. So I saw 20 patients that day. It wasn't 9, it wasn't 12, it wasn't 17, it was all 20. 20 out of 20 had some kind of problem that could be prevented with a healthier lifestyle. Okay, so we have a serious problem. So let's dive a little bit into the pathophysiology. Why does this disease process happen? So these slides are courtesy of Dr. Klatt and Dr. Esselstyn. So this is an artery. This is an artery where the blood flows to the heart. And this is the center of the artery where the blood flows. This is the wall. This little brown line here, that's the endothelial cell. And we want to treat that cell very well. It's our friend. We'll dive into that a little bit more. And because so this is normal, and because I went to medical school, I can tell you that this is abnormal. And that's just if there are any young Frankenstein fans in the audience, that was for you. This is, so all of this is a bunch of cholesterol grummus in the artery, and this is a teeny tiny hole where the blood can flow. So you may know some people, or this may have happened, they go for a walk, and then they get chest pressure, they take a pill under their tongue, and it gets a little bit better, and they walk again, and it just keeps repeating itself. This is what they have, a problem just like this. So we want to prevent that. And so the way this process typically starts is these endothelial cells, it's one cell layer thick, they can get damaged, whether it's from inflammation, pollution, a toxic Western diet, smoking. These endothelial cells will get damaged. And when that happens, these cholesterol particles can then go from the bloodstream and burrow into the wall of the blood vessel and become oxidized, where they're incredibly irritating, like a splinter. So like if you've ever had a splinter, it gets all red and inflamed. Well, it's the same kind of thing, except it's happening in the wall of your artery, making it sicker every second of every day. So this cholesterol particle burrows in, becomes irritating like a splinter, creates tons of oxidative stress, tons of inflammation, and weakens or damages the endothelial cells more, letting more cholesterol particles in, and the whole process kind of snowballs. So, and there's also this white line here. This white line is called the fibrous cap. And that cap is the only thing that's between all of this cholesterol grummus and the blood that flows through the artery. And you never want these two things to touch, because this cholesterol grummus can make the blood clot and let no more blood flow to the heart. But over time, with the oxidative stress, with the inflammation, with the ongoing injury, this fibrous cap gets thinner and thinner, and there's blood rushing by it every single heartbeat till one random Tuesday afternoon, boom, it cracks. This cholesterol grummus gets exposed to the blood, blocks off blood flow, and then that's a heart attack. No more blood flow to the heart muscle. That's a medical emergency. You may have seen those medical dramas. Someone rushes in, oh my God, they're having a heart attack. They have to go to the cath lab right now. This is what they're having. And that's an emergency. You want a stent then right away. But we want to prevent this. This is a histology picture of what we just talked about. This is an artery, the center where the blood flows, all the cholesterol in here. And you can see that fibrous cap cracked, blocked off the artery, and of course, this patient did not survive. This is a picture of a heart. This is an artery that feeds the heart with blood. This here, that's a clot from a cholesterol blockage that cracked, and the fibrous cap cracked and clotted off the artery, and the patient died. So, I thought it would be interesting to show y'all a picture of what a heart might look like after a heart attack. So I read, one of the things I do for my job is I read ultrasound pictures of the heart. So ultrasound pictures of a baby. Well, we go a little further north, and then we take ultrasound pictures of the heart. So this is an ultrasound picture of the heart, and you'll just have to take my word for it. This is normal. So this is, I want you to focus on this. This is the left ventricle here, and that pumps blood to the body. So if you ever feel your pulse, well, what the pulse is each time this squeezes, it pumps blood to the body, and that gives you the pulse. So that's what's happening. Okay, and this is normal. So I thought, well, I want to get one that after a heart attack, and I didn't really look for an ultrasound in any organized way, but it literally only took me like 2 minutes to find one. And so here, you can very well see the difference. Let me go back. Well, so you can remember how the whole wall here was squeezing well. And here, you can see the whole top part isn't moving anymore. This person is lucky to be alive. Okay, so we talked about the scope of the problem. It's obscene. We talked a bit about the pathophysiology. So why a plant-based diet? Why might a plant-based diet be helpful? So we're going to walk through a variety of pieces of evidence about that. We'll talk about epidemiology or population-based studies. We're going to talk about something called trimethylamine oxide, our endothelial cells, interventional studies, and some other information as well. Okay, so what I like to do is to look to where heart disease is not, to get a sense as to why that might be. So, okay, we're going to take a bit of a world tour. And our first stop is going to be in rural China and China in the late 70s, early 80s. And there was an incredible study there done in part by Dr. Colin Campbell, the China study. And they looked at about 6,500 people all throughout China, in rural areas and cities, and they took tons of health measures about them. What they ate, lifestyle, various blood and urine tests, and basically what they found was the fewer animal products you ate, the less disease you had. And it just kept on going. Fewer animal products, less disease. It never seemed to reach a floor. And that was incredibly impressive. But okay, maybe that was just China then. Let's fast forward to China now. And there's a very interesting study recently published by a Dr. Du in the New England Journal of Medicine, where they looked at about 450,000 people throughout China with over 3 million years of patient follow-up time. And what they looked at is, let's look at tertiles of fresh fruit consumption. Tertiles of fresh fruit consumption. So the lowest third, middle third, or highest third. And let's see what that did to a variety of outcomes. So this is a bit of a busy slide, but this is what they found. This is more fruit consumption, all on the x-axis, more fruit consumption. And then this is disease. This is cardiovascular death, major cardiovascular events, ischemic stroke or hemorrhagic stroke, which is a bleeding stroke. And basically, the more fruit you ate, the fewer events you had. The people who ate more fruit had lower blood pressure. The people who ate more fruit had lower blood sugars. Yes, they ate more fruit and had lower blood sugar. All right, so let's bounce to South Africa. There's a very interesting study there done by Dr. Burkitt, in part, of Burkitt's lymphoma fame. And he was noticing that the local population had very seemingly low rates of heart disease. But the South African white population, which ate much more of a Western diet, and the local population ate much more of a plant-based diet, the South African white population had among the highest rates of heart disease in the world. So we wanted to try and quantify that a little bit. And they were living right next to each other. So he went to this hospital in Johannesburg, where the South African black population would get admitted. And he looked over about 10 years, and there were about 40,000 admissions each year in that hospital. And he said, okay, I'm going to look in the medical records and see how many cases of heart disease were diagnosed here in the medical charts. So 10 years, 40,000 patients a year, about 400,000 patients. And so what he found in the South African black population were about 30 cases of heart disease in the medical charts. Now, I could take you to the cardiac wing of Montefiore right now, and there'll be more than 30 cases of heart disease right now. Now, clearly there could be detection biases with that study, and of course you can find flaw with many, many studies, including this one. But it's incredibly fascinating that this population, the South African black population, eating primarily a plant-based diet, had such a seemingly low rate of disease compared to their South African white neighbors who lived right next door eating a typical Western diet and having among the highest rates of heart disease in the world at that time. But okay, maybe that's just South Africa. This information is reinforced in the US. Now, this is a really cool study. In this study, they looked at a handful of databases of over 130,000 people with over 3.5 million years of follow-up. And what they said is, let's replace 3%, just 3% of your calories from animal protein with 3% of calories from plant protein. Now, this is an observational study. In this study, they replaced 3% of animal protein with 3% of plant protein. And what does that do to outcome? The bottom line is, if you replaced 3% of animal protein with 3% of plant protein, you had lower mortality rates, less death. So, okay. Now, they were able to break it down, because it was such a big study, by different kinds of meat, or of animal products, excuse me. So in this study, processed red meat had about a 34% lower hazard of mortality. Unprocessed red meat, about 12. Poultry, 6% lower. Fish, 6% lower. Eggs, 19% lower. Dairy, 8% lower. If you replace 3% of your calories of those things with 3% of calories from plant protein, it was associated with lower mortality among all these different groups of food. Now, these were in patients who had at least one risk factor for heart disease. Okay, but let's bounce to Europe. We're in South Africa, that was US, let's bounce to Europe. This is the EPIC study, a great nutritional study, the European Perspective Investigation into Cancer and Nutrition. And they looked at about 23,000 people over almost 8 years. And they looked at 4 healthy lifestyle measures: not being obese, regular exercise, not smoking, and having a reasonably healthier diet. Not the kind of diet I want my patients to eat, but certainly healthier. And diet, of course, is a continuum. So what they found is, if you had all 4 healthy lifestyle measures compared to none, you had about an 80% lower rate of a chronic disease. Okay, let's bounce to England, which I'm not sure if it's still part of Europe anymore, but so in this study, they looked at about 65,000 patients, and they followed them for 7 years. And what they did, and they can do big studies like that because they're a national health system, and so they looked at fruit and vegetable consumption, servings of fruit and vegetable per day, and was that associated with living longer or living less long? What was it associated with? The bottom line is, the more servings of fruit and vegetables a day you had, the lower mortality rate over this period of time. So it was associated with living longer. And it just kept on going, 1, 2, 3, 4, all the way up to 7, but they couldn't look beyond 7 because there's so few people did that, the statistics kind of fell apart. Okay, so let's bounce back to the US and the CARDIA study. And this is a study of coronary risk factors in young people. And so they looked at about 2,500 people and followed them for about 20 years. And they looked at fruit and vegetable consumption when they were about 25. And then 20 years later, they got a CAT scan of their heart looking for cholesterol disease. And they split them into tertiles. If you were in the highest tertile of fruit and vegetable consumption when you were 25, you had a significantly lower risk of having cholesterol disease in your heart 20 years later on CAT scan. Pretty impressive. Okay, let's bounce to the US and Canada. This is the Adventist Heart Study. And the Seventh-day Adventists, they treat their body like a temple. They have a variety of very healthy lifestyle measures. Are very healthy lifestyles. And so in this study of about 60,000 people, they looked at different dietary patterns and its association with diabetes. And so here you can see they looked at vegans and lacto-ovo-vegetarians and pesco-vegetarians and semi-vegetarians and non-vegetarians. And even those who were non-vegetarians in the Seventh-day Adventist population typically eat more healthfully than the average, say, Western diet. But be that as it may, still, in this study, the vegans had the lowest percentage of diabetes. And let's look at body mass index. Now, a body mass index less than 25 is considered normal. And the only eating pattern in this study of about 60,000 people with a normal body mass index was the vegans. All right, let's bounce to Sweden. And in Sweden, they did a similar study to the EPIC trial, except they looked at about 5 healthy lifestyle measures. The same 4, not being obese, regular exercise, not smoking, and having a reasonably healthy diet. And they also looked at moderate alcohol intake. That was the difference. And in this study, if you had all 5 versus none, you also had about an 80% lower rate of a chronic disease. Okay. Now, one pushback I typically hear is, well, it's all in my genes. My grandfather had it, my grandmother had it, it's all in my genes. And genes matter, and genes run in families, but so does lifestyle. Lifestyle also runs in families. So this is a very interesting study. I know it's a complicated slide, but basically what these investigators did, it's really amazing work. And what they did is they developed a genetic risk score in a variety of populations, looking at about 25 or 30 different genes that are associated with higher risk. Genes do matter. And then, not surprisingly, the higher your genetic risk, the more likely you were to have cardiovascular disease. But then what they did is they looked at the influence of lifestyle on this genetic risk. And whatever your level of genetic risk, the more healthfully you lived, the lower your risk of cardiovascular disease. And their threshold for a healthy lifestyle was fairly low. It was just a modestly healthy diet, exercising at least once a week, and that was what got you into their healthiest category. So even that, which I would argue is not extremely healthy, even that modest change made a significant impact on the association of the genetic risk with mortality. So you can impact, it seems, your the family history with lifestyle, according to this study. So really, really fantastic stuff. Now, so many of you have seen the incredible documentary film Forks Over Knives, and I encourage my patients to watch that. Now, this slide or this study may seem familiar because they also reported this study in Forks Over Knives. And so this is mortality from circulatory diseases in Norway. So we're back in Europe now. And in Norway, this is from 1927 to 1948, and they were eating a typical Western diet. And you can see they were trucking along with a fairly high rate of cardiovascular disease. And then what happened? 1940, World War II, and the Nazis came to town. And what did the Nazis do? Well, they did a lot of stuff, but one of the things they did is they took the livestock from the local population for the use of their soldiers. And so the people were left to eating more of a plant-based diet. And as you can see, when that happened, heart disease rates plummeted in the people they didn't kill. So heart disease rates plummeted and stayed low, but then fortunately, they lost the war, and the people got their livestock back, and boom, heart disease rates shot right back up. The public health initiative of the Nazis, right? So I think what we did is we missed an epidemiologic signal here. And so, okay, now we're going to bounce to something called trimethylamine oxide. Trimethylamine oxide is a compound that you do not want to have. It promotes cholesterol disease in the blood vessels in your body. It raises cholesterol levels, and it is associated with many adverse outcomes, more heart disease, even associated with more death. Okay, so what can you do about it? Well, the way it comes about is, this is an interesting study, and this study, they fed people who were self-described vegans for a year, and people who ate a typical Western diet for a year, they fed them a steak. And they said, let's see what happens. So when they fed the people eating an omnivorous diet the steak, they made trimethylamine oxide through a variety of steps. They made TMAO, we're called TMAO. But when they fed the vegans the steak, they made virtually none, virtually no TMAO. What's going on? Well, our gut bacteria is going on, and we each have about 1 trillion gut bacteria. It's called our microbiome, and they profoundly impact our health. And when you eat a more Western diet or an animal-based diet, you select for gut bacteria that interact with compounds in the steak that lead to the formation of trimethylamine oxide. And when you eat a plant-based diet, you select for virtually none. So, okay, now the compound of interest in the steak was L-carnitine, because that's what interacts with the gut bacteria leading to the formation of TMAO. All right, who cares? Well, L-carnitine is structurally similar to choline. Well, choline is in poultry. Choline is in fish. Choline is in dairy. Choline is in eggs, the egg yolks. When you eat those things, that also leads to the formation of trimethylamine oxide. But choline is a required nutrient. Well, the good news is it's in plants, and you can get it from plants. But Dr. Ostfeld, you just said if you eat choline, it can lead to the formation of trimethylamine oxide. Well, when you eat plants, you select for virtually none of the gut bacteria that lead to the formation of TMAO. So the plants give you their dozens and dozens of nutrients and the choline and protect you, kind of like creating a coat of armor in your stomach, protecting you from also creating trimethylamine oxide. And higher levels of trimethylamine oxide are associated with more and worse prostate cancer, diabetes, death, making your blood more sticky. It is not your friend. Okay, so we talked about epidemiology, trimethylamine oxide. Let's talk a little bit about our endothelial cells, that one cell layer that lines the inner wall of our arteries. Okay, so I need a little audience participation again. What's the circumference in miles about of the Earth? Okay. Y'all are all over that. So yeah, 25,000 miles. Okay, so about how many miles of blood vessels do we have in our bodies? So we have about 60,000 miles of blood vessels in our bodies. So it's no wonder that if we treat our blood vessels well, we treat every square millimeter of our bodies well. This is a picture of an artery, and these are the endothelial cells. So if I were to take all the endothelial cells out of my body and lay them on the ground, I would fill up about 7 tennis courts worth. We want to treat them well. And the endothelial cells make something called nitric oxide. And a Nobel Prize was awarded for the discovery of nitric oxide. And what nitric oxide does, it does many things. It helps blood vessels dilate, get bigger. So if I go for a jog and I need more blood flow to my legs, well, then my endothelial cells in my legs dilate up. Nitric oxide makes blood less sticky. Nitric oxide quiets the inflammation going on in the wall of your blood vessel. It is an antioxidant. It helps to protect you from the process of atherosclerosis. So, and when you eat a plant-based diet, it enables your endothelial cells to make more nitric oxide. And I'm just going to skip over this slide. This is more a mechanism as to why, but I'm just going to skip over that for now in the interest of time. And this is a great comic. This is a great comic. Halfway through his Hearty Man breakfast, Dwayne thought he heard some of his smaller arteries slamming shut. And Dwayne's right. He's absolutely right. And I find this interesting for a couple of reasons. The first one is this whole notion of a hearty man, the whole notion of a hearty man. And that's evolved over the years, but I think we could agree a steak-eating, cigar-smoking guy, that's the hearty man. And that is, of course, the exact opposite of what you need to do if you actually want to be hearty. But it's also interesting because some of his smaller arteries are slamming shut, and Dwayne's right. So there's very interesting work done by Dr. Vogel, Robert Vogel, cardiologist, and what he did is he looked at blood vessel function in people under a number of different situations. And so the way he would measure blood vessel function is he took a blood pressure cuff and inflated it all the way, And then, so there was no blood flow to the hand for about 5 minutes, so it's not particularly comfortable. And then you let go, and then normally the blood vessel dilates up. That's normal. And so he took young, healthy men, and he fed them either some basically whole grain cereal or some animal products, animal breakfast food. And he said, let's look at what happens to their blood vessel function. So these are young, healthy men, and those who had basically the whole grain cereal, their blood vessel function, no problem. Dilated up, no worries. And then the young, healthy men who had like the animal breakfast food, these are young, healthy men, their blood vessels didn't dilate. And after about 6 hours, then they finally dilated back up. But then you know what time it is. It's lunchtime and chicken parmesan. And then dinner time and pizza. And on it goes, meal after meal. We are pounding away at our endothelial cells, and it's no wonder that they give out over time. You know, it's kind of like, you know, Mike Tyson is in there pounding away. The good news is I heard that he's vegan now, so that's great. So no more ears for him. So the diet makes a profound impact just in the moment, and it's not just your blood vessel function. Diets like the unhealthy one we just mentioned also acutely impact lung function, making lung function worse, and asthmatics are more likely to get readmitted to the hospital. It also acutely worsens liver function, creating the milieu for non-alcoholic fatty liver disease. And of course, these are transient processes after just one meal, but it's meal after meal. It's amazing. One impacting our whole body. Okay. So those endothelial cells are our friend, but our body regenerates itself over time, our skin, our heart, and our endothelial cells. And there are these things called endothelial progenitor cells that come from our bone marrow and go and replace the old senescent endothelial cells. And so in this study, they looked at people with cholesterol blockages in their heart, and they looked at how many endothelial progenitor cells they have. And those who had the most had the best outcomes. Those who had the lowest number of endothelial progenitor cells had the worst health outcomes. All right, so what? What can you do about that? Well, it seems you might be able to do something about that. And in this study, they took young, healthy Okinawan women, maybe the healthiest people in the world, and they had them eat their typical diet versus their typical diet plus more green leafy vegetables. And those who ate the more green leafy vegetables made more endothelial progenitor cells. So you may be able to modulate the number you have. Okay, so we did a little bit of a world tour. We talked about how a plant-based diet helps protect you from making trimethylamine oxide. We talked about the importance of keeping our endothelial cells healthy. Let's touch base about some interventional studies now, where we actually did things a little bit longer term to people. And so just so we're on the same page, we're going to talk about plant-based diet. And of course, that's eating vegetables, fruits, whole grains, beans, lentils, salads. And so I'm going to walk through a number of studies. This is great work by Dr. Dean Ornish. And what he did is he took people with known significant cholesterol blockages in their heart, and he randomized them into two groups, one with a healthy lifestyle intervention and the other one with usual care. And none of these patients were on cholesterol pills at the time. And the lifestyle intervention was eating much more healthfully, almost exclusively a plant-based diet. There was a little bit of animal product in there, but almost exclusively a plant-based diet, exercise, psychosocial support, and the other group had usual care. And after just 1 year, the blockages in the blood vessels that feed the heart with blood on the Ornish diet shrunk, and the usual care under the expert guidance of their physicians grew. 1 year. And they followed up 5 years later, and they only had data on about 35 subjects, and the trends continued. Those with the healthier lifestyle, the blockages continued to shrink, and those under the expert care of their regular physicians, the blockages continued to grow. Okay, and not surprisingly, degree of compliance matters. Those who ate more healthfully in this program had more shrinkage in the of the blockages in their blood vessels. So I want to get to great work by Dr. Caldwell Esselstyn. And he has encouraged people to eat a whole food, plant-based diet. And this is an observation of 200 patients that he had with cholesterol blockages in their heart, and he asked them to eat a plant-based diet. And so he had about 200 people. Their average age is about 63, followed them for about 4 years, and about 90% of them adhered to the healthier lifestyle. So of these 177 patients who adhered, 112 had chest pain or angina from the cholesterol blockages to begin with, and it got better in 104. 27 of them avoided bypass surgery and stent, and they lost on average 18 pounds. And of those 177 patients with known cholesterol blockages, only one of them had a recurrent event. One, that's 0.6%. That's really impressive. But of the 21 patients who did not adopt the healthier lifestyle, 13 had a recurrent event. That's 62%. 62 versus 0.6%. It's subtle, right? And I want to compare this a little bit to the PREDIMED study. In the PREDIMED study, they looked at a healthier lifestyle. They basically looked in people with risk factors for heart disease, not known heart disease, but risk factors, and they had them have a Mediterranean-style diet versus what was essentially a Western diet. And not surprisingly, the Mediterranean-style diet did better. Lifestyle is a continuum. And I'm just going to skip that. But interestingly, in the Mediterranean-style diet study, they looked at patients who ate, in the Mediterranean arm, more of a plant-based diet, more of a pro-vegetarian pattern. And those who ate more of a pro-vegetarian pattern in the PREDIMED study did even better. And this is reinforced by that EPIC nutrition study, where every standard deviation increase in fruit and vegetable consumption was associated with less mortality. Now, this is a great case that Dr. Esselstyn mentions. Now, this is a patient of his who who's a surgeon, young, healthy, fit, early 40s, a runner, a couple of young kids, and he started having chest pain, and he had a heart attack. They rushed him down to the cardiac catheterization laboratory. They had to shock him back to life 3 times. He died 3 times. They had to shock him back to life. And this is the cardiac catheterization. They put a catheter in the blood vessel in the groin and threaded it up to the heart and injected the blood vessels that feed the heart with blood with dye. And this is the picture they got. And this is a lot of cholesterol grummus there. But at the time, bypass surgery wasn't an option. Stenting wasn't an option. But he was fortunate he survived. And he later adopted Dr. Esselstyn's whole food plant-based diet. And he chose not to have a cholesterol-lowering pill. And that's cool. The patient's the boss. So then 3 years later, he's doing well, and he has a repeat cardiac catheterization. And he walks into Dr. Esselstyn's office and gives him a big hug. This is his repeat cardiac catheterization 3 years later. I've been a cardiologist now for 14 years. I've never seen any other intervention, medication or diet, have an outcome like that. It's N of 1, very impressive. So I want to compare the plant-based diet to the COURAGE trial. Now, the COURAGE trial was a really important study in cardiology where they took people with stable cholesterol blockages, not a heart attack, but just cholesterol blockages in their heart, and randomized them either to maximal medical therapy, and please be a little healthier, versus maximal medical therapy, please be a little healthier, and we're going to put in a stent. And after about 5 years, there's no difference in the groups in terms of living longer, fewer heart attacks, the same. And so to me, that means in stable heart disease, not a heart attack, but stable heart disease, a stent is palliative. So, okay, now, but in the COURAGE trial, they had about a 19% event rate. And since in Dr. Esselstyn's study, they also had stable heart disease, and in the COURAGE trial, they had stable heart disease, I thought it would be an interesting group to compare. And so it's apples and oranges, different studies, but if you look here at Dr. Esselstyn's program, they started with the total cholesterol of 237 and got down to 137. Their LDL cholesterol got down to about 76, and their event rate in those who adopted the lifestyle was 0.6%. In the COURAGE trial, they got down to about 141, an LDL cholesterol of about 71, and they had about a 19% event rate. Now, remind you, these are different studies, but such impressive differences in groups that are somewhat similar. So why might that be? So I don't know exactly why, but my hypothesis is that when you get yourself to an LDL cholesterol in the 70s on a path that includes a plant-based diet, you bathe your body in a panoply of nutrients that's good for you for dozens and dozens of ways. Yes, for your cholesterol, but for many other reasons. And that's what accounts for the difference, is my hypothesis. So chest pain in the plant-based diet improved in 93% of people. How about in the COURAGE trial where they included stents? 73%. How many procedures did they prevent? In Dr. Esselstyn's group, they prevented 27. Now, in the COURAGE trial, I only looked at the arm for this on my back of the envelope calculation in those who had a stent, who did not have a stent to begin with, because sometimes you can have to go back for an emergency procedure. So to be fair, I just looked at the 1,000 or so that did not have a stent. How many did they prevent? They didn't prevent any. They had 348 new procedures. How about lifestyle? How much weight did the groups lose? In the plant-based diet, they lost about 18 pounds. In the COURAGE study, they gained about 3 pounds. So a swing of about 21 pounds, which is about half the size of my niece. Okay, plants or burgers, you choose. Plants or burgers, you choose. This is courtesy of Dr. D'Alessandro. This is a picture of coronary artery bypass surgery. This is the patient's head here. Their feet are down there. This is their heart. It's stopped. Their chest has literally been sawed open. And they're taking an artery from the chest or a vein from the leg and stitching it in to bypass or go around a blockage. So it's great that we can do this if we have to. It's great that we can do it if we have to. We, of course, would rather prevent it. And the following has been said, but you know, when I go around and ask people to eat more kale, to eat a plant-based diet, some people will tell me that I'm extreme. Like it's somehow extreme that I'm asking people to eat more plants, because I and others think it's extreme when someone saws my chest open, stops my heart, and takes a vein from my leg and stitches it back in. Like, when did the world turn upside down? Okay. In this study, this is great work by Dr. Barnard. He took people with type 2 diabetes and randomized them to a plant-based diet versus the American Diabetes Association diet. And hemoglobin A1C, a measure of diabetes, fell more in the plant-based diet. They lost more weight. Their cholesterol fell more. The people on the plant-based diet came off of more more diabetes medications. Very impressive. So this is your health insurance. Let food be thy medicine, medicine be thy food. That's by Hippocrates, the father of Western medicine. So doc, I did everything they told me to do. Why did I have a heart attack? Well, that's because we have not been telling you, in my opinion, the right things to do. So here's a great quote. And it's by a cardiologist. That's not the only reason why it's great. So it struck me as a peculiar paradox that guidelines highlight the primary importance of nutrition and lifestyle, yet the physicians who are expected to implement these guidelines receive absolutely no education in these areas during their residency and subspecialty training. And this continues to this day. Now, times are changing, things are improving. I've had the privilege of giving a lecture on plant-based nutrition to the second-year medical students at Albert Einstein College of Medicine for the last 4 years, and things like that are starting to happen in other places. So times are beginning to change, but we're still way behind. Right, so the Super Bowl was on recently, and so you all remember that great broccoli commercial, right? Like, of course you don't, because there was none. You know, there's no big broccoli. And you can slice or dice what I'm about to say in a variety of ways. But these are advertising dollars spent in 2004. So the top 8 fast food chains spent about $2.3 billion on advertising. And there was a federal program at the time, 5 a day, 5 servings of fruit and vegetables a day. Some of you may remember that. They spent $4.9 million. So I couldn't make sense of those numbers in my head. So I turned them into seconds. 2.3 billion seconds versus 4.9 million seconds. So that's 73 years versus 2 months. But times indeed are changing. This is a quote from Dr. Kim Williams, the immediate past president of the American College of Cardiology. In my myopic world, that's a big deal. So, and he goes, I recommend a plant-based diet because I know it's going to lower their blood pressure, improve their insulin sensitivity, meaning improve diabetes, and decrease their cholesterol. This is great. So let's circle back to our guy at the beginning who had chest pain, walking around or even sitting still and didn't want to have anything stuck in him or take any medications. And he went on a plant-based diet. What happened to him? So after about 3 or 4 months, his weight became normal, his blood pressure normalized, his LDL bad cholesterol fell a lot, and he was able to walk about a mile. And I have this reference here. Now there was, interestingly, a study of a very important medication in cardiology that helped people walk longer, help improve, people with chest pain walk longer, made their symptoms a little bit less. And in this study, this drug became a blockbuster. It sold for about $370 million in sales a year at that time. And this medication that was approved by the FDA, big blockbuster, helped people walk a little bit further. Now, if you go from 1 to 3 blocks to walking a mile, I don't know, that's 10, 12 minutes, I guess, more walking. This medication helped people walk about 20 seconds, 24 seconds longer. They may have been walking at a faster pace during this measure, so in defense of the drug, but that one drug was a big blockbuster. It's an interesting comparison. So let's fast forward a year. Blood pressure normalized, LDL even further reduced, and he's jogging now 2 miles. I saw him about, I don't know, a year ago, and he jogs about 4 miles now and stops because he gets bored. What typically, I'll present this slide, and what I usually get is, Dr. Ostfeld, he's doing a lot better. That's great, and all these numbers are improving, but what about the HDL? That's the good cholesterol. That fell. What's going on? Well, it's true. There are a variety of epidemiologic studies that suggest that higher HDL levels are better. But it's well described that when you eat a plant-based diet, your HDL levels fall. And what is more important is actually, the devil, like anything, is in the details, the function of the HDL particle. Now, the HDL can suck cholesterol from the wall of your blood vessels, kind of like a vacuum cleaner. And we call that its efflux capacity, its vacuum cleaner capacity. And the better vacuum cleaner capacity the HDL particle has, the healthier it is. And studies have demonstrated that it's that vacuum cleaner ability, independent of the level, whether it's 25 or 55, but the better vacuum cleaner ability, the better outcomes you have. And there are aspects of a plant-based diet, particularly pistachios, that can improve the vacuum cleaner capacity of the HDL particle. So when I see this happening, it makes me actually secretly happy, because when the HDL falls, I know they're doing it, and I believe that their HDL efflux or vacuum cleaner capacity is, of course, improving. And then when you step back, you don't want to lose the forest for the trees. The patient is doing much better as well. So we did a world tour. We touched base on trimethylamine oxide, endothelial cells, interventional studies, the Dr. Ornish randomized trial, Dr. Barnard randomized trial, the Dr. Esselstyn observational style, and comparing that to Courage. We just touched base on the HDL particle, and that LDL, that bad cholesterol that can burrow into the wall of the blood vessel. You remember, it can get oxidized and act like a splinter. Well, that process of turning it into a splinter is harder when you eat a plant-based diet. Okay, so let's go. We talked about the scope of the problem. It's obscene, the pathophysiology, why it happens, why a plant-based diet might be helpful. And let's go somewhere scary for a cardiologist, which is, of course, beyond the heart. And one of the reasons I'm very excited and happy to share this with my patients is because of the associated benefits it keeps. It keeps good company. So we're used to CAT scans, right, looking for something bad. So I thought, wouldn't it be cool to do a kale scan and look for something good? So I thought, well, let's see, what are some things that are associated with improving when you eat more of a plant-based diet? So let's just go from top to bottom. So eating more of a plant-based diet is associated with living longer from the studies we talked about. Many of you are on social media. Facebook, you may remember that ice bucket challenge from a couple of years ago for ALS. Well, eating was it Alzheimer's? I forget which one now. I think ALS. Eating a plant-based diet is associated with less ALS, less dementia, less stroke, less cognitive decline, better skin complexion, less acne. Now, some investigators suggest that acne isn't really a vestige of teenage angst, but rather your body crying out for lack of nutrition. Fewer ear infections, less periodontal disease, less laryngeal disease, less lung disease, less breast cancer, less heart disease, less obesity, less diabetes, less high blood pressure. If you're a 55-year-old adult in the US, your lifetime risk of developing high blood pressure is about 89%. That's based on Framingham Heart Study data. And every time I read that, I have to reread it. It's so unbelievable. But when you eat a plant-based diet, you are anything with the average Western adult. Less diabetes, less high blood pressure, less colon cancer, less constipation, less prostate enlargement, less prostate cancer, improved sexual function in men and in women. Now, erectile function in men, there's a vascular component, there's a neurological component, and there's a psychological component. And the blood vessel that feeds the penis with blood is smaller than the blood vessel that feeds the heart with blood. And if that artery has a blockage, it's going to make it more difficult for the penis to become engorged. But since that artery is smaller than the artery to the heart, we look at erectile dysfunction as a canary in the coal mine for heart disease. Because by the time you have a blockage in that smaller artery in the penis that's causing blood flow trouble there, it is extremely likely you also have a blockage in the blood vessel in your heart that has just not yet clinically manifest. Less lower back pain, improved bone health, better athletic performance. I think I got most of those things. This is some evidence to support that. Okay, these are nutrients in plant versus animal-based foods per 500 calories. Plant versus animal-based foods per 500 calories. Okay, the plant-based foods are equal parts tomatoes, spinach, lima bean, peas, and potatoes. The animal-based foods are equal parts beef, pork, chicken, and whole milk. Let's see, cholesterol. You don't need to eat a drop. Your body makes all you need. How about protein? Oh my God, my muscles are going to fall apart tomorrow. It's the same. How about beta-carotene? It's subtle. How about dietary fiber? Your constipation will go away. You know, we have bones to keep us standing. Plants have fiber. How about iron? Oh my God, I'm going to become anemic tomorrow. How about calcium? My bones are going to fall apart. Don't believe me about the protein? Take multiple athletes' words for it. The strongest man in the world, Patrick Baboumian. And the reason I know he's the strongest man in the world is because he won the strongest man in the world contest. And he did that by carrying 1,200 pounds, about 15 meters or something, basically a car down the street. And he's plant-based. There are plant-based ultimate fighters. You all have seen Ultimate Fighting? I mean, they're pretty impressive athletes. Many of them or some of them are plant-based. There are plant-based professional football players. There are plant-based bodybuilders. There are plant-based ultimate extreme athletes, triathletes, long-distance runners. So you don't have to take my word for the protein. Take their word. And of course, exercise is an important part of a healthy lifestyle. And this is, of course, the Vegas Strip. Nobody takes the stairs. But that's okay, because I went to the American College of Cardiology meeting. And I'm like, I can't believe this is happening. I have to take this picture. So some of the benefits that are ripple effects of eating this way, looking beyond my myopic heart world, is its impact on cancer. Now, this is great work by Dr. Colin Campbell. And in this is an animal study where he took rat livers. He had a model of rat liver cancer. And he looked at the number of rat liver cancer clusters. And so what he did is he fed them either a diet with 20% casein, which is, that's the animal protein that's in cow's milk, casein, or 5%. And he looked over time. So he fed them a 20% casein diet. The number of cancer clusters increased. He switched them then for 3 weeks onto a 5%. Number of cancer clusters went down. Flipped them to 20% up, 5% down. He literally was able to turn on and off the number of cancer clusters simply by changing the amount of animal protein in the diet in this rat liver model. It's pretty mind-blowing. And this is really great new stuff from the New York Times. Cancer is increasing among meat eaters, and vegetarians show the lowest mortality of all. This is, of course, from 1907. Then this is great work, really interesting stuff from Dr. Ornish and others. And we all have our genes, right? Make our eye color, hair color. We can't change them, but we may be able to change which ones speak. And in this study, he took men with early stage prostate cancer. So there's a lot of debate about the exact way to treat them. And he put them on a much healthier lifestyle, almost exclusively a plant-based diet, exercise, psychosocial support, and biopsied their prostate before and after about 3 months. And what he found is that dozens of anti-cancer genes were upregulated in their expression, and many more pro-cancer genes were downregulated in their expression. So you couldn't change your genes, but you could change which ones speak, making the healthier ones speak more loudly and the unhealthy ones speak more softly. It's pretty mind-blowing. But it gets even more mind-blowing. There's a switch, basically a switch that turns those healthier genes on and the unhealthy ones off. And that switch, at least in animal models, appears to be passed on to our kids and grandkids in animal models. So what an incredible responsibility. The healthier food choices you make today, it impacts you, impacts the environment, and it may impact the health of your kids and grandkids as well. Okay. How are we doing on time? Another 5 minutes. Okay, so I'm going to jump through a bunch of stuff. This is just other pieces of evidence about why eating a plant-based diet is healthy. Let me just see what I have here. I'll touch, our program is based here in the Bronx, New York, just south of Yale here. And so I get to see patients in clinic, and in a variety of ways we encourage them to eat a plant-based diet, and we follow up. And one of the aspects of our program is we have these periodic Saturday morning sessions that are 4 hours long, where we really get into the how and why of eating this way. We serve a plant-based diet. We encourage people to come with a friend or significant other. There's a large indigent patient population in the Bronx, and we don't charge anyone for these sessions. I want to democratize this information as much as possible. I fund it all through donations. And it's been incredible, the kinds of patient turnarounds that we've seen. One part of it, we give patients handouts with very specific eating plans. We give them handouts with information, all sorts of things, including how to transition your home. This is the lunch from one of our sessions, usually very well liked, different dishes that we have. I'm going to jump through all of this, given time. One aspect of the program that I'm particularly proud of is we somewhat recently started to have plant-based meals for inpatients in the Montefiore system, available in 5 hospitals in the Montefiore system now. And Montefiore is a huge system. I think it has 11 hospitals or affiliated kinds of places, and employs more than 40,000 people. So it's been great to be a part of that shift. And so in those 5 hospitals within the Montefiore system, you can order plant-based meals. We call it Heart Healthy Vegan. And also the documentary film, Forks Over Knives, plays on inpatient TVs. So, you can watch, I'm very happy about that. Now, you can watch other typical channels, but you can also turn on Forks Over Knives, which is terrific. So now I can go into.
I just want to mention, we showed Forks Over Knives in the library, and we still have it in the system. You could borrow it from the library.
Oh, great. So Joan was mentioning how Forks Over Knives is available in the library system, the Chappaqua library system here online. So that's terrific. And so now I can walk in. It's great because before I'd walk into a patient's room and I'd talk with them about it. And Montefiore does an amazing job of trying to make the local community and the wider community healthier. They have farmers markets, and they work with the Green Card program, and they've done a lot of stuff to improve the health of the food in their hospital system. But I would walk into the patient's room and I would tell them about a plant-based diet, and then, a poultry dinner would be served. And I'd sort of be undercut. And so I needed an infrastructure, a posse, if you will, to help me. So now I go in, I tell them about a plant-based diet. I can order a heart-healthy vegan meal, and I can turn on Forks Over Knives on the TV as I'm leaving to reinforce it and outsource, if you will, some of the education. So it's really just a wonderful resource that we have. And we're having our first preventive cardiology conference at Montefiore on October 27th. So if you're interested, keep an eye out. There'll be many of the luminaries speaking. Dr. Caldwell-Esselstyn, Neil Barnard will be speaking. Kim Williams, the past president of the American College of Cardiology, and Paul Ritger from Harvard, Dr. Paul Ritger of CRP fame, will be speaking as well. So we're really very excited about that. And this is a great quote to almost end with. So today, no one can deny the possibility of adequate nutrition and the prolonged maintenance of health and vigor on a vegetarian diet. That's from the Journal of the American Medical Association in 1912, before the term vegan was even coined. Okay. More doctors smoke Camels than any other cigarette. This is ridiculous, right? This is ridiculous. This was in medical journals maybe 40, 50 years ago. These were advertisements in medical journals to doctors. You can see the friendly doctor, the red M and D. It's ridiculous. And what I'm hoping is that the discussion that we're having today, fast forward a few years, will also be ridiculous. Of course we'll know that eating a plant-based diet or extremely close to a plant-based diet is healthier. And I look forward to that day, and many of you are far along that path. So 1 second, sir, excuse me. So we talked about the scope of the problem, pathophysiology, why a plant-based diet, and we went beyond the heart. This is the website of our program. And so thank you very much. Yes, sir.
I have a question.
Sure. The question is that this gentleman has been a lifelong vegetarian and is very interested in going further to being fully plant-based, but you've heard that the vegetables and fruits are also carbohydrate rich and may promote diabetes. Am I phrasing your question correctly, sir? Okay, great. So vegetables and fruits have carbohydrates in them. And broccoli is somewhere around 35 or 45% protein. I mean, it's not a lot of calories in one stick of broccoli. But so I couldn't disagree more strongly with the advice that you were getting, that eating a plant-based diet will promote diabetes. So let's talk about some reasons why I might think that. One of them is that randomized trial we talked about with about 100 people, where they took people with diabetes already and randomized them to the American Diabetes Association diet versus a plant-based diet, and they had more improvements on a plant-based diet. If we bounce to the study from China, where they looked at about 450,000 people and fruit and vegetable consumption, fresh fruit consumption, those who ate more fresh fruit had lower blood sugars. Now, there's a big difference between the sugar in fruit and the sugar in, a sugar cereal. The sugar in fruit comes in complex carbohydrates, which makes it a slow-release pill, as well as the myriad of other phytonutrients that live in the fruit. Now I'm going to oversimplify what I'm about to say, and so my apologies. A main reason that people get insulin resistance, which means our pancreas makes insulin, and so when you eat carbohydrate, now we need sugar to live, but when you eat carbohydrate, that insulin comes out of your pancreas and then it pushes it for storage into the muscle cells. And sometimes those muscle cells could become resistant to the insulin, and the sugar can't really go in. The whole works are gummed up. And then it backs up into the blood, the sugar does, and then that can lead to diabetes and complications. Now, that resistance in large part is driven by something called lipotoxicity. Now, when you eat animal-based products, it leads to fat being deposited in the muscles in your body. And that fat can make insulin work much less well, cause insulin resistance. And when you eat a plant-based diet, it can improve that that lipotoxicity, that insulin resistance. So I encourage my patients with diabetes to eat a plant-based diet and to eliminate animal-based foods. And actually, an issue that I have is for my patients who are on insulin. When they switch, I have to be very careful because we may make their blood sugars and improve their diabetes so much that they may not require as much insulin. And if I don't have their insulin lower along the way, we could actually cause them harm because we push their blood sugars dangerously low. So we have to be careful about that. So what I see is the exact opposite. When my patients go on a plant-based diet, they require less and less insulin. And we have to be very careful about that transition. So I think there's mechanistic evidence, there's epidemiologic evidence, there's randomized trial evidence, and for whatever it's worth, my clinical experience, where I would 100% completely disagree with that advice that you got. Yes, ma'am.
I am a 30-year.
So Judy is 87, and she is an RD, and she got her RD from Tufts. And she wasn't exposed to plant-based nutrition initially, and actually had a patient, was referred to her along the way by a doc who said, here, I want you to see this nut. He wants to be vegetarian. Her daughter is a plant-based RD. A plant-based nutrition coach, and has had incredible turnarounds in her patients. And Judy herself is plant-based and is exceptionally healthy, and she was describing a variety of ways in which that is the case. And she's had the privilege of watching things evolve over time. And one thing she mentioned is even though she's super pro plant-based, she made a point to describe how she is not a plant for me here in the audience. So thank you. Hopefully I summarized that okay. Yes, sir.
Just put in context a little bit.
Right, the question was about, well, there's a lot of advice about we eat too many carbs. And how does all this fit into that? And it fits in a handful of ways. First of all, I think that, and I know you're just describing what newspapers and things are saying. I think that's too much of a reductionist way to think about it. And the reason I say that is, we don't sit down to eat a plate of protein. We don't sit down to eat a plate of carbs. We eat food. And food has carbohydrates and protein and other things in it. And so I don't ask my patients to eat a certain percentage of this or that. And my patients have the most obscene turnarounds I've ever seen. Now, I'm certainly not going to recommend that patients eat simple, highly processed carbohydrates. No one's going to suggest that that's healthy. But that randomized trial for diabetes patients on the whole food plant-based diet, they have whole grains in it, and they did better. So I think that that is a very misguided and confusing information for the public. And when you eat truly a whole food plant-based diet, and that means minimally processed stuff, you don't have to think about that stuff at all. I have never seen a patient walk in protein deficient. I've seen them walk in healthier. The only nutrient that you need to supplement is vitamin B12. Because, I mean, I don't know a more nutrient-dense way to eat than a plant-based diet, but it does not have B12. And the reason is B12 lives in the soil. And now that we wash our vegetables and fruits so much, it goes away. But animals have it because they eat soil, or other animals that eat soil. So that is one thing you do need to supplement. But no, I do not encourage my patients to go low carb, and I encourage them to eat a whole food plant-based diet, which includes truly whole grains, includes beans and lentils and chickpeas, and fruit has carbs and vegetables have carbs, and they do better. Yes, sir. Well, thank you. And this gentleman he's 22 years old and mentioned how he's been plant-based for a while now, and has had many benefits, and including losing 100 pounds on a plant-based diet. So thank you for sharing that. So I think, I'm not sure. All right, 2 more questions.
Questions, not statements.
Okay. Yes, sir. Right, so the question is, this gentleman has become whole food plant-based, and also a number of people in this whole food plant-based movement also encourage no oil. And so what's the story with that? So now, I also encourage my patients to not have oil. I didn't bring it up today in part because I feel like it's the weakest leg of my evidence, so I don't necessarily go to the mat on it, but I'll explain why I feel that way. So the reason that I do is because in a big picture sense, you take a perfectly good olive and then you suck out the oil, leaving behind all the phytonutrients and fiber, and you basically have a pile of fat with almost no nutrients. It's the most calorically dense thing we have, 120 calories per tablespoon or teaspoon, I forget now. It's the most calorically dense thing we have, and we also know that olive oil worsens blood vessel function. Studies done by Dr. Vogel. And interestingly, he did a study where he fed people a salad, their blood vessel function improved, then a salad with olive oil, the blood vessel function didn't improve as much anymore. So, and they say omega-3 fats are important, and they are. They definitely are. But you can get them in other ways. Hemp seeds, chia seeds, flaxseed meal can be converted by your body into omega-3 fats. And if for some reason someone thinks you need it, you can get a plant-based omega-3 supplement. So I do not encourage my patients to have oil. And my patients who have the most ridiculous turnarounds you've seen, like avoiding bypass surgery, and are the ones who also avoid oil. So I do encourage my patients to do that, but I do think it is the weakest leg of the evidence, so I don't really go to the mat on it. I think we have time for one more. I think, ma'am? Yes. Yeah, well, thank you, and thank you for coming. There's a family medicine physician in the audience who's been encouraging her patients to get healthier and healthier, and taking differing approaches. Sometimes encouraging them to take a stepwise approach, and other times maybe a bigger step. And so, I mean, I think you've touched on one of the critical issues, behavior change, which is, I think, the holy grail of medicine. And we all kind of know that eating kale is good for us, but getting ourselves to do it can sometimes be another thing. So I don't know the right answer to that, but I'll explain what I do and why I think it's reasonable. Now, my goal is to get people to go all in, make a huge change, rip the Band-Aid off, if you will. That's my goal. The reason that I do that is because a number of these foods can be addictive. And so if you don't stop them, you won't lose that addiction to them. And also, taste buds can change over 2-3 months. So if you make a small change, you won't really lose the addiction. You won't really get the taste bud change. And also, if you make a big change, you see benefits very quickly. Usually within 1 or 2 weeks, people's clothes fit a little bit more loosely. We're able to start lowering blood pressure meds. They feel like they have a little more energy. So I feel like it sells itself. So my goal is to get people to go all in. But look, that doesn't work for everybody. And I see a lot of patients who, when I mention a plant-based diet to them, they look at me like I'm from Mars. They've never heard of it. And, so, and for many of them, I'll encourage more of a stepwise approach. And for those handouts that I have 3 different levels, and one being the healthiest. And I have some animal-based foods in my least healthy level, very minimal, but I have some for those patients who just are not interested in going all the way in, and then I try to bring them along the way. So I'll take both approaches. I'll take what they can get. If someone says, all I'm going to do is 20%, I'll take it. It's better than nothing. I don't want perfection to be the enemy of good. So I don't know the best way to get there, so I try to pitch to my batter and figure out where that patient is, and then just try to bring them along. And I've had patients who've given me the Heisman, blown me off for 3 years. And then they just come back 25 pounds later. I'm like, what happened? They're like, oh, I just decided to do it. I'm like, what? So, so if someone knows the secret ingredient to behavior change, please share.